I'm sure a lot of people here know who you are, Lenny. But why don't you give them a little bit of background about yourself? And obviously, we're talking about this whole dynamic systems theory approach to movement assessment and rehab. So give us a little bit of an insight into how you kind of integrated that into or how you came across that. Why did you integrate that into your approach? What do you think is helpful? And then we can kind of go off in different angles there from there.
Yeah, sure. Thank you very much. Well, it's been a long road. I've been doing this now 30 years. And I think, in short, early on, I had more of a systems thinking approach to just life in general. Maybe because as a young boy, I got bored doing the same thing over and over again. And I really appreciated nature and all the interconnections. As little kids, we never were indoors. We were always outdoors. And I always looked around and always wanted to know how things worked. And then as I matured over time, I started to realize all the interconnections. And early on, I had a mentor who said, Lenny, no matter what you do, you can always find a connection to what you love to do. Mm-hmm. And if you do things that you love, which is an unnamed unity, you'll never work a day in your life. And I think that's kind of what started the whole passion to understand how everything is truly connected.
Mm-hmm. Absolutely. Yeah, it's so important. And like I said to you, we were chatting the other day, and when I first got started with physical therapy, when I started working in the real world as a new grad, my first insight into this was actually working with clients with prosthetics and rehabilitation. And so you realize then the importance of looking at many layers to an individual's movement when you start working with those clients, because they don't have any limb anymore. And so you need to look at different layers to an individual's movement control system, understand how the central nervous system exploits many properties and layers throughout the body, because that's essentially what they do in prosthetics and rehabilitation. They have to look at natural human gait and understand what are the qualities that an individual needs to be able to express in that lower limb, and then how can we take those qualities and mimic them within a prosthetic limb. Okay, so you don't need a central nervous system to be able to do that, but you need to mimic the qualities of an individual's body in a prosthetic limb. And so you can start to realize, hey, it's not necessarily all about the central nervous system, which a lot of people think it is, but it's about all the interactive parts that allow movement to unfold in a more of a robust manner.
Wow. Yeah, I mean, there's a saying, right? Without the body, there's nothing to perceive.
Exactly.
And without the mind, there's no perceiver.
Exactly. Yeah.
So our mind is actually shaped by our senses, right? So
absolutely, yeah.
Truly, truly connected. And that's what I started to see is so much reductionism.
Mm-hmm. Mm-hmm.
And I think there's a need for it.
Yeah.
However, when you take reductionistic protocols and you apply it to an open, complex system, which the organism is, mm-hmm. there's too many constraints and weaknesses.
Exactly. Mm-hmm. And that's such an important point. And I think nowadays we have approaches that look only at the brain, or approaches that look only at the body, right. and it's kind of our goal, and I know it's your goal as well, to really start to merge these different layers and these principles from a neurological perspective and also a musculoskeletal perspective too. And you have to merge them in a way that obviously respects the expectations of the client as well, in a way that mimics their real world movements. Because that was another big thing I learned from prosthetic rehabilitation too, is that when we're looking at trying to create a prosthetic limb for somebody, and they had chronic pain as well, and obviously we're not going to go too deep into prosthetics now, but you have to respect the user experience. Understand, what does the user have to do in the real world? Do they have to walk up and down stairs? Do they encounter any slopes? And so that's all going to have to be mimicked within that prosthetic limb as well. And so we can take those principles into anyone with any kind of movement or pain related experience, and understand how can we look at all these different layers that interact, right? And I think, go ahead.
This is something you and I talked about, and it's been a passion of mine, and this is solely selfishly. I never taught this. It's not even on my mind to go out there and make it a course, although I'd love to share it, and I'll share some of it here today. It's creating a framework that unifies us all. Like, I did it selfishly so that when I take your course, when I go to Gary Gray's course, when I go to FRC, which I think Dr. Spina and Shivers, they're doing a great job.
Absolutely, yeah.
As a student, I want to go in with a framework that then becomes strengthened.
Yeah.
So that's what I mean by a unifying framework. How can I talk, like in pro sports, I have the orthopedic group that we're talking with. We have the strength and conditioning, osteopathy is in our organization. We have chiropractic, obviously physical therapy, strength conditioning, all this stuff is there.
Mm-hmm.
But if we only stick to what they learned in school and only do that, it's reductionistic. Now on the athlete, they get confused.
Yeah.
So it was my selfishness that said, how can I create a unifying framework where we all work as a team, a true team?
Yeah.
No different than having 5 positions on a basketball court.
Mm.
How do you gel as a team? How do we professionals gel together?
Yeah.
There's got to be an approach that unifies us.
Yeah.
And principles guide this, but the framework.
Exactly.
And I want to share that framework in hopes that it creates some organization to the randomness that we see. You and I talked about that. There's a lot of randomness.
Mm-hmm.
You know, and Gary Gray taught me this years ago. He's like, be true to yourself. Look in the mirror next time you work with a client and ask yourself, why are you doing what you're doing?
Mm-hmm.
But answer it using unifying principles, not principles of the trade, not principles of the skill or principles of the profession,
mm-hmm.
but unifying principles,
yeah.
principles of nature.
Absolutely.
And it's humbling. It's very humbling because then there's a lot of times I was in the clinic going, I don't know.
Mm-hmm.
It's just because someone told me.
Yeah. And that's one of the big issues I found, especially when working as a new grad, and then even working with the new grads that we teach. Like sometimes when they go into a consultation with an individual with some kind of pain experience, they're looking at it blindly. So they don't have that framework to guide their assessment. And that's, like you said, it's really, really important when it comes to looking at things from a dynamic systems standpoint, is that you have to have a model, you have to have a framework to try and look past the complexity. Right. And the nice thing is that obviously when it's a good thing, but it's also kind of a stressful thing for a lot of people trying to make this transition, is that when you're working with a complex system like the human body, there's always going to be more than one right answer. You know, if that wasn't the case, like there wouldn't be so many different professions out there. There wouldn't be chiropractor, there wouldn't be massage, there wouldn't be physical therapy. And so it's just about having that clear framework, like you just said, based on unifying principles that just helps you guide your assessment.
Well, how often have I heard this, and I'll put it on myself, I've done this, where you're not getting the results.
Mm-hmm.
And so you think you have to take another class. You have to learn a new skill set. And I'm not saying that doesn't help, but I see people doing this all the time as they go from one camp to the next camp to the next camp. What I would like to share is this confidence that if you have a framework to what you do on a day-to-day basis, and you have principles that guide it,
mm-hmm.
you'll always have that confidence to know you're going in the right direction.
Mm-hmm. Yeah.
And confidence is very different than cockiness.
Mm-hmm.
Defensiveness that I see out there, where's the evidence?
Mm-hmm.
It's usually a weakness.
Yeah.
Right? It's a weakness because there's some insecurity that you just don't know it all. Well, guess what? We're never going to know it all.
Mm-hmm. Mm-hmm.
That's the whole idea of a complex system. It's a constant feedback loop. There's dynamic interdependencies that are going on all the time.
Mm-hmm.
So if you don't have principles and a framework, you're going to feel lost at times, frustrated at times.
Yeah.
It took me a long time.
Yeah.
You know, it took me a long time.
Absolutely, I'm sure. Like, even to go on what you said there, like every situation clinically is always an N=1 scenario, isn't it? And so you can never depend on the research fully. You can be informed by the research, but you can never control all the variables that go into an individual's experience. Like when they look at studies and they look at, right, there's manual therapy. Is manual therapy effective for someone with back pain? Like what if that person came from a stressful day at work, or from an argument with their partner at home, and they're going into the same clinical scenario? That's going to influence how their nervous system perceives the actual stimulus that you're delivering. And so you can never control for all those variables.
And that's where, like, what you just said is perfect. So you could go ahead with the argument and say, well, true or false, are we, the human organism, a system, an open complex system? And the answer is true. So what are the three things that are essential that must be there for it to be a system? There's three things. There's elements, there's interconnections, and there's a function or a desire. You have to have all three.
Mm-hmm.
Okay, it's a never-ending dynamic process of interdependencies. So those are all facts, not a Lennyism or a Ryanism, right? So now when you look at a lot of research, they use reductionistic protocols. Like you said, they take out the variables and then they conclude or make an assumption, right? Great information, but you can't just go with that and run and say no. And that's what I see is the pendulum swings from one end to the other.
Exactly.
And, the saying goes, there's truth in the middle.
Mm-hmm. And the last point you made there about how your body needs that intention, it needs that goal, right? And that's so important when you're looking at things from a research perspective, because you could have 100 people with back pain, but each person might have a different goal when it comes to functioning in a world. Some people might have pain getting out of their car and they might have back pain. Some people might have back pain going up and down the stairs. Some people might have back pain picking up their kids, but they all have a different cognitive goal that guides their movement, control their movement, organization. And that's a fundamental principle, like you just said, when you're looking at things from a dynamic systems perspective.
Yeah, for sure. So I think for the listeners, those three things are really important to consider, because we can get caught into looking at an element. We have a saying, just something we throw out there to kind of change the thought process, stimulate a thought process, is use motion. So use motion, use movement, assess capacities, think continuum, because anatomy really is a continuum. The parts are more of a mind construct based on the way we study it, the way we dissect it, the way we write about it. But the truth is it's a continuum, and there's all kinds of proof on that. And the last thing is reference structures. Okay, so if you think about that, use movement, assess capacities, which includes the environment, the person's sensorial experience, both mind and body. Think continuum and reference structures, it's opposite. There's not a day that I don't get a referral for somebody and it's a list of parts. The psoas is tight, the hamstrings are restricted, there's a lack of this. What I want to know, and this is the framework that I have, is where is the movement intolerance? Where are the movement intolerances? Where can they tolerate movement? Because from there I can create an objective way to then create a system to help them.
Yeah, absolutely.
How do you go about that?
I actually, and this is how we came about to know of your work, Lenny, is that I had a colleague in New York City when I first worked there. I kind of moved from the prosthetic clinic into more of an outpatient orthopedic clinic. And my colleague there was a member of the Gary Gray Institute. And so he did an awful lot of those 3D movements from an assessment and also a movement standpoint. And I think the reference center, so the reference standpoint is really, really important, right? Because that ultimately drives movement from a real world standpoint. And so one of the things I got from him is that when you're looking at real world movement, let's say, for example, we can make it kind of specific to a pain experience. Let's say somebody has hip pain or lower back pain. You need to look at that hip pain and lower back pain within the context of the entire lower limb and the entire midline, for example. You need to understand, what does that lower limb have to do in the real world to express robustness, to be able to withstand stressors. And you think about the reference point that interacts mostly with the real world, and it's the foot. The foot is what interacts with your environment directly. And then everything else more proximal takes on more of a self-regulatory standpoint, or a more of a self-regulatory role to keep the foot on track, or keep the foot able to tolerate load as it moves from distal to proximal. And so that's one of the biggest things I got from Gary Gray's work through my colleague. And even with the upper limb, it's the same thing. You look at the hand. How's the hand? The hand is in direct contact with the real world. You don't pick up cups of coffee with your elbows or walk down the street on your knees. And so you have to look at the kind of the distal segment, the endpoint, I think they call it in dynamic systems theory. These are or they call it the interface mechanics with the environment. What's happening at the hand, what's happening at the foot, and how's that driving what's happening more proximally.
Oh, neat. So it's fun to listen to you because it's like we're following the same principles. We might have a little bit of different framework in the way we talk about it. Like, for example, when I say capacities, like really what does that mean? When you look at the raw definition of strength, and you hear that word thrown around a lot, it's the ability for the organism to produce an internal tension against an external load. And the overarching unifying principle of all of this is energy. The more energy efficient one is, the healthier they are. Right? And so if I see somebody, like what you were saying, if I see somebody and they're moving efficiently with grace, it's a beautiful flow of all these interdependencies. Right? The body is able to disassociate, but in an integrated way for the task. All of a sudden they hit a sheet of ice. What happens? The hand, the feet, everything comes in. It doesn't go out. The brain protects by going inward. So that's where we came up with this acronym HARP: holding tension, active tension, resting tension, and passive tension. And it's real neat because right now, in fact, they just had a big webinar on Monday, Dr. Robert Schleip, on connective tissue. And there's a conference next year in Germany. And they're talking about some of the missing links in strength and conditioning, the passive recoil capacities. And they now know in walking and running, muscles don't really concentrically and eccentrically activate as much as they once thought. They realize that the muscle is more of a tuner to the connective tissue. And there's this beautiful force transmission that occurs. And a lot of the length changes happen in the connective tissue. Now, it's interesting when you look at the connective tissue, they don't utilize calories like muscle. So again, it's energy efficient. I use the silly example of your finger. If I press down with my index finger into my chest as a holding, active would be concentric, eccentric, or just nice isotonic flow. And a passive would be an outside force coming in, kind of like the foot hits the ground. So gravity and ground reaction. And now I go like that. Well, that's much more powerful and energy efficient than holding and wasting a lot of energy. So when we're watching our clients move, you can start to see when they fatigue, their body starts to hold, or their system becomes rigid where it cannot efficiently go from one plane to another plane.
I think the idea of energy efficiency is so important because I don't as a physical therapist, I think that we don't consider that enough, because when you come into the world as a child, for example, you don't come in with an infinite amount of resources or an infinite amount of energy. And so you need to be able to share stress or share load over a number of different systems. And going back to your point there about trying to utilize the non-contractile or the passive components of our musculoskeletal system is one of the primary ways that the central nervous system exploits the properties of the body to reduce energy output, to make your movement more efficient. And we were talking about this the other day as well, in that a lot of clients with persistent pain or with any kind of movement capacity issue, they tend to lack the ability to exploit those passive properties, right? Where they might be moving in a way where they're using those concentrically driven movements to kind of fight the ground and fight gravity instead of actually attenuating gravity and utilizing their muscles in more of an isometric or an eccentric manner. Because with those types of contractions, that allows us to be able to dissipate load or distribute load into the non-contractile components to share stress. And that's efficient.
Yeah, in reality, the acronym HARP, like a harp, right? It's a harmony. It's all working together. And it's constantly changing. There's holding tensions, there's active, there's resting. And resting is not to be confused with collapsed, like an unhealthy organism. There's resting tone in the body that can be extremely healthy. Like right now, I'm seated. My foot doesn't have to be stressed as much as if I was walking. So it can be at rest, but there's a resting tone, and then passive. And again, great athletes that move. For those of you that are watching Michael Jordan, you know, this big series that's out right now on ESPN. And you talk about his ability to angle against gravity, disassociate body segments in an integrated way, and passively recoil. I mean, it's beautiful.
Yeah.
Because the passive recoil is the most energy efficient. So that's where some of the researchers talk about muscles as being tuners to the connective tissue. But it goes back to the reason why we're on this tangent. It goes back to, it's a system.
Yep.
And if you define system, you totally appreciate that. But if I'm stuck in reductionism, trying to look into an organism that's very dynamic and is a system, it becomes like, I get frustrated.
Yeah. And even to make it more, I suppose, clinically applicable, like if you were to look at any kind of lower limb pain, let's say knee pain or even hip pain, you don't want to always kind of hyper focus on the parts, but you want to look at the whole limb and ask yourself, is the individual able to exploit or take advantage of those passive properties throughout the lower limb to be able to dissipate load, or is the knee being overloaded because we're not taking advantage of those passive properties, if that makes sense? So don't always hyper focus on the pain, but step back and look at the principles of the properties throughout the entire limb as a whole. Look at the whole limb behavior and see, does that limb express the properties to be robust for real world movement, to drive energy efficient movement? And so Lenny, we can talk a little bit about the framework that you might use when you're kind of assessing an individual with any kind of pain experience. Like we can talk about, let's say, lower back pain, and talk about what is because I think the issue is that a lot of therapists, especially new grads, they'll, like I said to you before, they'll be blind when a client comes in. They won't know what to look for. And I think when you're looking at a complex system, you have to have some kind of model or some kind of framework to look past the complexity in the back of your mind, even before the client enters the treatment room. So what does that look like for you?
Well, I have it all written out. And I did this a while back as a cheat sheet for myself. Like today, I'm actually going into the clinic. We're doing a slow opening now that a lot of our restrictions are lifted here. And I look at this. Obviously, when I'm in front of somebody, I want to have this memorized because I want to be reading this. But I wanted to bring this up to the group in hopes that they can see the framework and either A, go, oh, that's universal, so I can use that framework, or B, it sparks interest in yourself to create your own framework. So this framework is my brain walking in. So I'll express that first, if you don't mind, and then I'll talk about, okay, now let's channel low back pain into that. How would I apply? Is that okay?
Absolutely, yeah.
Okay. So obviously there's three guiding principles. Now, let me go on a quick tangent about principles. To be clear, it's not a book that you're going to read that says, here are your principles, and then go and do it. Principles, A, should be unifying, not profession driven. Because in physical therapy, you're going to have the principles of physical therapy. For your company, you might have the principles for your company. I'm talking about unifying principles, principles that unite all of us humans in this world we live in, okay? Where they come from is weaknesses, roadblocks, problems. So as I experienced issues, like I'm not getting results, I had to try to figure out a solution. And if you want to read a great book that blew my mind, because I was doing this way before I read the book, is the book titled Principles by Ray Dalio. Absolutely phenomenal, because he talks about this in depth. And they actually have a children's book now, which I have on the coffee table, and I read that often, because it's a summary it's very simple, but then it strengthens what you read in his book, Principles. And he talks about this. It's life. Okay, so look at the evolution of knowledge, for example. We go to school, we obtain all this knowledge, yeah? We go to classes, we obtain knowledge. What that does is it evolves into a skill set. So now we learn skills. Then with the skills you experience, this is a big one. You experience, and hopefully you experience from all different populations and not just one. Now I know a lot of people, they only got into pro sports. They're going to be great at that. But the fourth part, judgment, the judgment's going to come from the experience. You with me? So there's knowledge, there's a skill set. The third is experience, and then the fourth is judgment. And I look at myself now, 30 years into this business, my judgments are very different than when I was 10 years in. And that's the evolution of all this. And I look back and I said, man, I'm glad I didn't just work in pro sports, only working on Ferraris, right? I want to work with all populations. Now, a population I haven't worked with, like use prosthetics, I haven't. So I don't have that experience. I don't have the judgment. Okay. The point I'm making with all this is what guides you through this and it allows you to strengthen your framework are principles. So over the years, I had all these principles, but there were too many of them, even though they were unifying. So what happened over time is I made a judgment to condense them all down to 3 categories. And then there's a myriad of subcategories. And my 3 are sense, motion, and integrity. And that took years of experience to make that judgment that these are the principles that I could literally walk into any session and come out with some success. Because the questions I ask myself at the end, and I'll go through the framework, is what are the movement intolerances? Why? Because we know movement is critical to health. If something doesn't move in the organism, it will degenerate, it will decay, it will die. You can't lose by expanding options for movement, okay? So the questions that I ask myself is, did we create an optimal sensorial experience? Now that's not just with the body, but also the mind, and I hate to separate them because they're really together. Okay, and this goes on to something that happened to me not that long ago. Somebody said, do you know what the golden rule is? And I said, yeah, do to others the way you want done to you. And he says, well, that's really selfish, Lenny. You want to change your practice? I said, of course, that's why I'm here learning. Because you got to follow the platinum rule. Do to others the way they want done to them. Yeah. It like blew me away because I'm like, whoa, what does that mean? So the first word, sense, is the way we perceive our world. And a lot of us talk about sensory organs, but we have all these senses, right? So the word is so simple, but it's very complex when you get into what the sense category can bring you as a practitioner. Like if I take your class, you might strengthen my framework within this principle big time, things I've never even heard before. So that's kind of how I study it, these 3 categories, which are my principles: sense, movement, and integrity. So you got the sense part, and then you have the movement, because as I said, it's like expanding options for movement is always a positive with respect to the human organism, always a positive. And then the word integrity, which means undivided whole, really unites the environment with the sensorial experience and the movement, right? So there's people out there that may not sense anything. I'll give you a great example. My son is 14. He has no aches and pains, feels great. He loves playing basketball. So let's go back to a reductionistic way of looking at him or assessing him. He comes in, he's like, yeah, I just want to be assessed. I want to be a better basketball player. And I throw him on a table and I start looking at passive range of motion and I start doing all these tests on him. I did not come away with how is his integrity in the thing that he wants to do called basketball.
Yeah.
So how can I make any conclusion on that? That makes, hopefully, no pun intended, sense to everybody. What blows my mind every day is if you were the best surfing coach in the world, Kelly Slater. You said, Lenny, I'm over in Ireland right now. Send me a bunch of still pics of you surfing. Let me coach you. He's not going to be great at coaching me because it's a dynamic process. But yet every day we look at MRIs, we look at x-rays, we look at still pictures, and we come up with this full-blown rationale as to why we're going to do what we're going to do. So the word integrity becomes very important. Very important. Now, with all that said, sense trumps all. Okay, sense trumps all. Because sensory input drives motor output. So the word sense, motion, integrity, and I'm just giving you kind of the brief example of this. This gets kind of, into a lecture all in itself, but I wanted to express that to you before I go through the framework. So the framework is really simple. It's a 4-step process. And then my programming is 5 phases. Okay, so the first is driven by, obviously, sense, is the subjective intake. So there's 2 things I look for, the purpose and the function. So the purpose is the intention. So I would love to hear word for word. I ask my clients word for word, why are you here? Simple question, why are you here? How may I help you? How may I help you today? And it's interesting to ask that question even if you've seen them multiple times. How may I help you today? So that's what they're going to express to me. From there, I would say, give me an idea of your day. Give me an idea of your day. I want to know, did they walk up and down stairs? I know they walked in. And a quick tangent for you. This is Gary Gray really taught me this years ago. I think I was like 28 years old, a long time ago. I was going on the reductionistic mindset. And he said, Lenny, were they brought in on a stretcher? And I go, no, they walked in. He goes, then they're moving globally. So immediately, way back when you're taught the person's walking in and say they had the low back pain as your example, immediately they go to the table. And he quickly got me out of that thought process. He's like, you went from here to here, zoom, just like that. Doesn't make logical sense, okay? So the 2 things is purpose and the function. And what I'm trying to get from the function is what did they do with their movement? Like, what's the movement like? I know they walked in. Okay, so from here, that brings me to the second step, global. Global is always relative to the person. Okay, when my wife had an unfortunate incident where she was in the ICU for 28 days, her global movement at her ankle would look like maybe local movement for someone else. You with me? So global is always relative to the first step, what their capacity is at this point in time. So from the global, and again, I select that based on the person. Now, you've probably heard this many times. Gait, walking, running, these are really amazing, fundamental, natural patterns that are like the window into the nervous system. So I do often, if I'm going to choose something, I choose what they're already doing, walking. And it just so happens in our clinic, there's a waiting room and people will have to walk to the back. And if I can, I try to walk behind them. I try to walk and observe how they're moving into our place. So they don't think they're being watched. But I'm very observant to all the natural things that they're doing from the time they get up from the waiting room to the time they get into our place. Okay, because that could be the global assessment right there. Now, if I want to tweak that, I might take a walk and we start to drive it differently to test the reaction. So for those of you that are not used to what I mean by that, drive to test the reaction, I always use this as an example. I'll have people stand up, and I don't know if the camera can see me. And if you guys are watching this, it's fun to do this because it proves a very strong point with principles is you take your right hand, so you're in standing, you take your right hand and you rotate to the right as far as possible. As far as you possibly can, like I'm doing. Okay, you come back, do it one more time, reach really high now. Look up at your hand, rotate to the right as far as you possibly can and freeze. So I will promise you right now your left foot's pronated and your right supinated. You feel the medial column of your left foot is to the ground where you have more weight distribution on your right foot on the lateral column. That was a driver that created a reaction. The body self-organized based on the position and the loading and the urge or demand. That's how we learn to move. The way a human learns to move is through pressure and tension that we sense that's driven by urge. So as much as I studied movement, I always ask myself, how do we even learn to move? People say, oh, watching my parents. What if a blind person I mean, if you've seen a blind person, they move, not as well maybe, but they move. So there's got to be another answer to it. So it's pressure and tension that we sense that's driven by urge. So that's an example how we could take a global movement and we can create a driver to test the reaction. And it goes back to what we said before, energy efficiency. So if all of a sudden I drove the body and the body then held tension as if it was walking on ice, the brain is protecting. So the whole reason why we do this type of testing is I want to understand authentic capacity, authentic. So when I use that example, how about a left lateral ankle sprain? The principle that I would share with people is true or false. We need load to heal, right? If load exceeds the tissue's capacity, we have a disruption of unity, which is injury. But what's interesting is also we need load. We need load into the tissue immediately. All the research is starting to mount on this. Although it's been out there for a long time, it's finally starting to surface. I listened to a lecture from the NBA the other day, and they're like, man, we got to get movement into the system after ankle sprains ASAP. But it has to be tolerable. So then the question is, okay, well, how are you going to do that? Well, I think the best way to do it is to have your principles and authentically drive the system to see what it has capacity-wise. So in a left lateral ankle sprain, it was interesting that I used a right hand, right rotational driver because my mind is on my hand. My mind's not on my ankle anymore. In fact, they're thinking you're a kook. Like I came in here, the purpose I came in for is my left ankle swollen. Okay, doctor says I didn't break anything. Red flags are cleared. I got to rehab. So the idea is your mind is over here, and what we're assessing as a practitioner is the load capacity of the left ankle. Now notice I drove you into eversion, which as you know is part of pronation. That's because that's the safer zone, right? If I took the left hand and went left rotation, that'd be a much greater progression with respect to load on the lateral aspect that's been disturbed. Okay, so that's just an example of how I take something global and we tweak it to look for the reaction. And I always say the truth, which is the nature of reality, is in the reaction. The truth is in the reaction. So if all of a sudden I get this person that can load it, I'm happy because now I have a homework assignment that I can give them to continuously load it so that we can help the healing process. And that's a big thing for me too, is people think they can fix things on the body. We're not a building. We're not a car. The only way tissue changes is with habit. So, and that's how we built a very successful cash-based business. People say, well, what's the difference? Well, we're going to teach you how to be the physical therapist. We're working as a team. We're going to teach you how to load your body so you don't have to waste a lot of time and energy coming into our facility. We're going to assess your capacity. We're going to build a plan and give you the things that you need to do to create the habit for optimal healing. Okay, so from the global, depending on what we see, it drops us into the third step, and that is local. And then I have two divisions in local. I have the active division of local, and I look at things from a joint excursion perspective. And we think, and this is thanks to Gary Gray and Dr. David Tiberio, we think distal to proximal, proximal to distal. So for example, if I'm looking at the hip, is it the pelvis coming over the femur? Is it the femur coming up on the pelvis? Or a combination of both? In reality, in global, it's happening at different speeds. Because remember, a joint is technically a space. That's all it is. A space designed for movement, right? Because a joint is an articulation where two bones meet, where the two bones meet creates a space. And then, I know that sounds so rudimentary, but it blows my mind that people don't realize that the hip is the knee and the knee is the hip. It's the same bone. Just one's proximal, one's distal. Okay, and that's why we always talk about use motion, assess capacities, think continuum, and only reference structures. But the point is, in these joint excursions, we're selecting the joint excursions relative to what we observed in the global. Okay, and it's still active. There's still, say, they could be standing. It's not that you can't do sitting and all that. It depends. And then the second part to the local is passive range of motion. So I look at, your traditional, this is where your traditional stuff fits. So don't throw it away. Passive range capacity. You can't get motion if you don't have it.
Mm.
You can't get motion where you don't have it, right? So those tests are great. But from there, we also go into a relatively new type of assessment, unless you're really studying like Dr. Langevin and Schleip and the Stecco group, and that is shear plane mobility. And on my Instagram, I actually show an ultrasound of the low back, where they found in majority of low back pain cases, the thoracolumbar fascia loses its shear plane mobility. And what that means is relative motion. Okay, Gary Gray was the first one years ago, and I haven't found any literature out there except in the visceral manipulation literature of the difference between real motion and relative. Now, this is a fascinating subject because a lot of the books mistakenly describe motion incorrectly. Okay, so real bone motion is your femur moving in space. Relative is how it's moving relative to the next part. You with me?
Mm-hmm.
So if I have two bones moving at the same speed in the same plane, what's the net motion at the joint? 0. But interesting, if you look at, for example, walking, when the left leg goes forward, okay, what is the right femur doing? Externally rotating, right? That's why we get a supinatory rigid foot for propulsion. With me?
Mm-hmm.
What's the joint doing? Internally rotating. Because as the pelvis rotates to the right, as is the femur, because of the mass momentum of the left leg, it moves the pelvis farther and faster than the right. Very interesting. And if you think about it, we have a lot of structures that get loaded eccentrically in internal rotation, which also helps for the slingshot propulsion. Yeah. Without getting too deep into the biomechanics, when I started learning that, I said, well, what about tissues? If there's real and relative motion at the joint space, what about everything else? And sure enough, one of the biggest injuries in the NBA, take a wild guess what it is. The biggest injury. The most common, I should say. Do you have any idea? Contusions. And what will happen with athletes is they get MRI'd all the time, ultrasound all the time. So we get to see this objective data. Thigh contusions are a big injury, and they hurt. And not to mention names, but there's been some top-level players that if that's not healing correctly, that leads to an ossification over time. Now what happens is we have decreased input. They talk about this in the literature now. The densification literally starts to fibrose and creates an ossification eventually, and then it affects the force transmission, and then the joint becomes disturbed. The patellofemoral joint becomes irritated. The knee joint becomes irritated. All because a year and a half ago, we had a contusion. So that's why this part of the assessment is also important. So to summarize, I look at the passive range capacity, regular traditional joint. Then I look at relative tissue motion, the shear plane mobility. And then the last thing is the tensional integrity. And you and I'd love to hear your take on this, but looking at specific positions that are all relative to what we've already talked about, and the person's ability to produce an internal tension against an external challenge. So we'll start off like isometrically, and we'll ramp that intensity up isometrically. Then we'll look at it through other loading parameters, such as isotonic and elastic recoil. So it's one thing if I can hold my hand here and say I passed that. Now can I move it through isotonically, but what about recoiling? Can I actually recoil and get the passive element? So we use that HARP in the tensional integrity testing. And then the last step is all of this allows me to record what tolerances they had, what intolerances, and then I plan. And then I have a very specific way I program, which I'm talking a lot, so I'll let you talk, and I can talk about that if you wish.
Yeah, absolutely. No, that was a really good insight. And going back to what you said there is that like the assessment is literally going to drive the treatment, because like we've spoken about before, and someone has asked a question there about the dynamic systems, how the dynamic systems theory, how it changes when it comes to movements, even after an injury. It's not a case where you need specific exercises to drive a specific change, but you need to understand where do you need to deliver load. Like, where do you need to deliver stress? Because ultimately, like, when you come into the world as a baby, you need stress to adapt. You need to deliver stress to the system, deliver load to the system, or else you don't get up onto your 2 feet to manage gravity. And gravity is the most consistent source of stress, right? And so I think that's important. What you said there is to help the client understand that they are good at certain things. Like, some things are really doing their job, but there's other things that we need to stress more, to share stress throughout the system. And you don't need to use very fancy or sexy exercises to do that, but you just need to be specific. You need to understand where you're delivering stress.
Right. And again, if I just say, you're like, Lenny, share with us your framework. It's subjective intake, global, local, plan. It sounds so simple. Yeah. So I actually have to go see somebody today in home for low back pain. And if you were to ask me what I'm going to do, the answer is I don't know. But I have a framework.
Yeah.
Like, I can't give you exact techniques I'm going to use.
Yeah.
I don't know if I'm just going to take him out for a walk and I'm going to tweak his walk because he's a golfer. And I know right now golfers in California can only walk. There's no carts. So maybe I'll tweak the walk a little bit and get more dynamic with the thing he loves to do. That's golf.
Yeah.
Or maybe I'll decide, you know what? He doesn't have the tolerance for that. He's actually really bad off when I get there. So he'll express verbally, globally, what he can't do. No sense of me picking a scab.
Yeah.
So I might go to my local active excursions: spine flexion, spine extension, lateral bending, and rotation. Right? So when I say joint excursions, it's great because a person can just go to any textbook and go, spine flexion, extension. Most of us know that anyway. You know, what am I missing here? You know, maybe, you know what, better look at the hips. I got to figure that out. And that's what makes what we do so fun. Because you don't know exactly what you're going to do, as opposed to a technician that memorizes all these techniques. And I've done it. You go to a weekend course, you learn these new techniques. Guess what everybody gets on Monday? Exactly what you learned. And I get it. I've also taught enough to say, hey, if I had a class right now that said 3 best exercises for low back pain, probably sell out. Because we want to feel confident. But what we have to do, people like yourself, your organization, is get people to understand that the confidence comes from the unifying principles and the framework you develop from them.
Yes.
And then you're working with people, not on people. Because the reality is, whether it be manual therapy or exercise, all these things are supportive. They're not corrective. I know people talk about corrective exercise, and you can define it in a lot of different ways. But what we do is we create these supportive techniques to get the organism to self-organize in a productive manner.
Exactly.
That's really what we're doing. That's the truth.
And that's a key point there, is that idea of self-organization. Like, that's one of the key principles when looking at things through a dynamic systems perspective, is that your body responds to load, your body responds to stress. But when you have a client come into your office for the first time, you don't know what the limiting factor is there, or the layer that's the limiting factor as to where it's not allowing for self-organization. So you need to identify those missing qualities or those limiting factors that's not allowing the client to self-organize. Instead of thinking, what do I have to do here? What kind of exercise do I need to throw at this individual? But if you do that, then you don't know whether or not you're actually restoring those qualities to help them self-organize. And that's, for me, that's the biggest thing, is that if you don't have a framework to actually assess what the client's missing, or those limiting factors, you never know whether or not you're actually restoring their ability to self-organize and be robust. Because all you're going after is trying to change symptoms and just shift pain perception. It's such a key kind of division in your mindset, I think. And we kind of look at it from a standpoint of, like, when a client comes into the office for the first time, you kind of have to look at things from the client's cognitively generated goals, where they come in and they have certain cognitive experiences, certain past experiences. They come to see you for not the pain necessarily, but for the way the pain makes them feel. So what that pain is stopping them from doing. So that should kind of feed into your assessment and your treatment process. But also, the client has nervous system goals, right? And those are different to the cognitive goals, where cognitively you want to run 5K without knee pain, or you want to go up and down the stairs without hip pain. But from a nervous system standpoint, it just wants protection. That's all it wants. And so we would look at it from a standpoint of what are the built-in protective mechanisms that exist within a person's musculoskeletal system that they're not accessing. Because if you have a pain experience, and obviously we've ruled out any kind of tissue damage or any kind of trauma in an area, that pain is an expression of the need to protect. Right? You don't know whether there's an issue in the tissue, but you know that the nervous system has made the estimation. Because when you're constantly gathering sensory feedback from the whole body on a moment-to-moment basis, your brain's always re-estimating where your body is in space, and it's always re-estimating, okay, is the body able to tolerate all the stress that's acting on it? Because we live in a gravity-driven environment where your body is really concerned about the forces acting on your system. And so we would always step back and say, okay, let's say if it's hip pain or lower back pain or any kind of lower limb pain, we would say, okay, what are those built-in protective mechanisms? What are those qualities that any individual with a lower limb needs to express to be robust? And when I say robust, I mean with that lower limb now walking in the real world, obviously they're integrating the whole body, but can the lower limb move, but can it also move and withstand stress at the same time? And that's what I mean by robust, where you're not just trying to quickly shift symptoms, but you're trying to allow them to re-exploit those properties that prove ultimately to the nervous system to say, hey, we do have the ability to protect these tissues. So the nervous system, higher parts of the brain, don't need to step forward and say, hey, I need to protect you even further by expressing this pain there. So for us, when someone's experiencing pain, it's just a sign that, and there's no evidence of tissue damage. It's just an expression that the higher parts of the brain have felt the need to step forward and express the ultimate form of protection, and that's pain. So we need to step back and say, how can we prove to the brain that we don't need that pain? That how do we create an environment where that pain or that protection doesn't serve any value? Because that the value in it is a change of behavior.
And still, a lot of people are still stuck, even physicians, in the Cartesian deterministic model of pain, right? So the way I like to summarize pain is it's about sensitivity. It's an experience, not a thing.
Yeah.
And you could say that to your blue in the face as a clinician, and people are still like, yeah, but my rotator cuff. No, we have so much research right now, all the sham studies they've done on, yes, you have those changes in the tissue. That's not necessarily why you're feeling what you're feeling.
Yeah.
Pain is it's interesting. A lot of things are sensorial experiences, and as humans, we reduce things down and we're trying to find out why.
Yeah.
It's kind of like, here's a fun one. I know we're probably getting into time, but when a practitioner imposes your hamstrings are tight, what does that really mean? Because tightness is really a sensation, not an architectural change. I mean, I've done enough fresh tissue cadaver dissections, and I didn't see, oh, whoa, look at Mary. Her hamstrings are this big. Johnny's are this big. It doesn't really work that way, right? So when you feel tight, it's actually a sensation. So with that understanding, a lot of people think it's inadequate blood flow, and it triggers the sensory organs to tell the brain, hey, tight. It's a sensation. With that being said, who the heck am I as a practitioner to tell you you're tight? That's like me telling you who you love.
Yeah.
Love is a sensation.
It's almost arrogant in a way, isn't it?
Totally, right? Yeah. So again, that's where we formulated these principles to be critical, analyzing a lot of the stuff that's out there.
Yeah. And I think even to just summarize this whole dynamic systems approach to movement and the assessment is understanding that there are many layers that you can assess. That you can assess the low capacity of many layers. You don't always have to go to the muscles. You don't always have to go to the joints. You can go to the nervous system. You can look at all the different layers. And if you identify any kind of what we call a low discrepancy, where you find something that's maybe not expressing the qualities that you would see as ideal, then you deliver load. You deliver load in a very specific and controlled manner. And then maybe that's the input that allows for self-organization. Right? And that just tells you that, again, the fact that they express some kind of change means that you don't always have to, like people always talk about, we have to find the root cause or the root of the issue. And it's like, there is no root cause. You know, when you do something to a complex system, a human being who is expressing pain, and they get a positive change, you can't step back and say, that was the root cause. You just can't.
Right.
Because you can't predict the outcome, because humans have evolved millions and millions of years, and you can't predict the outcome of an organism that's evolved over millions of years. That's arrogant in a way as well, to say that you can find the exact cause or the exact root of someone's issue.
Oh, you get it all the time. I mean, I see it day in and day out. If I'm in a clinic or in pro sports, we're around a lot of practitioners, and people are telling people that their spine is out of alignment, and this is tight, and it's not their fault. It's just the way we've been taught. So that's why I always come back to, where are the movement inefficiencies, or where is it intolerant? And the person expresses that. We can see it, observe it, but they also express it first and foremost. And then the 3 questions I ask every time, every session, because remember, the subjective intake, the global, the local, and the plan is a constant feedback loop. So every time I see a person, we're going through that framework, but 3 questions in mind every time. It's, did I create an optimal sensorial experience with the techniques that I chose? They could be a lot of different techniques. And that's why I encourage people to take as many classes as possible, but put the information into your framework.
Yeah.
Now, I promote, not just because I love the Gray Institute and all their classes, but I promote FRC. I think they're doing a phenomenal job. That's how you and I met up. I sent a few people to your classes. It's like, take as many classes as you possibly can, but make sure you don't become caught in a camp. What you want to do is you want to put it into your framework, because ultimately we have to go back and work with people. So those 3 questions: did I create an optimal sensorial experience? Did I expand options for movement? And did I teach a person a plan, a strategy, so they can build tension integrity? Because it has to be a habit. That's a fact. And I liken it to dental hygiene.
Yeah.
I don't just go to the dentist and they do the work and I leave and I don't do anything for my mouth. In fact, a great dentist will send you to a hygienist. The hygienist will then do their work, their evaluation, their techniques, and then hand you usually little tools to go home and continue it till your next session. That's exactly how we have to do it. We have to teach people the micro movements, the loads, right?
It all comes back to load and stress. I think people really need to, especially clients and as therapists, we need to do a better job of this. I feel as though we need to better reframe stress for an individual to help them not demonize stress, because stress is not necessarily bad. And even some people talk about, well, like when stress exceeds your capacity, it causes any kind of damage. It really doesn't cause damage, but it creates the need for protection. If you're pulling back someone's finger into extension here, it doesn't necessarily, I'm going to feel discomfort before I actually create any damage. But again, you're just creating a load, you're creating a stress. So the brain said, what the hell are you doing? It needs to create protection there to stop you from doing that behavior. And so you need to have those principles, and you need to not always try and look for the magic bullet exercise or the magic bullet technique. But if you do a needs analysis and you use that as part of your framework, if you do a needs analysis of the client and identify where they need load, where they're tolerating too much load perhaps, you need to understand, where do you deliver load to share load or share stress over a greater surface area, or grow over across tissues, across structures, to make them more efficient. And so what we like to do at IKN is look at the lower limb as the kind of within the whole context of the whole limb behavior. So any kind of hip, knee, ankle issues, we look at the whole lower limb behavior, look at the qualities it needs to express in the real world. And we'll do that for the upper limb and the midline too. And it just provides a nice framework to say, okay, you don't need to look at the local issue, the local area, but see how that fits in with the context of that whole limb or the whole midline. How are all those structures and systems cooperating or coordinating with each other to share stress? Because that's efficient. That's energy efficiency.
Yeah.
And the more you have to kind of think about your movement with a cognitive strategy, that's going to reduce your variability, because you don't have an infinite amount of resources available. So when you go back to your comment on how we need to allow an individual to re-exploit those passive tissues, those non-contractile components, that's just one way to do it. That's one way to share stress. And even though it might not be like if someone has knee pain or hip pain and you're trying to share stress across those passive tissues, it might not seem like it's directly related to the issue at hand, but you're just allowing the nervous system to experience a different strategy to share load. And then that's going to provide an environment where it can self-organize, where hopefully it doesn't feel a need to express pain or protection. So it's just about kind of stepping back, I think, looking at from this dynamic system standpoint and just looking at those universal principles that govern real world movement. Like, ask yourself, are you really preparing the individual for real world movement, or are you just trying to get them moving better in a clinical environment? I think that's a big mindset shift as well for people.
And if it's, something, our talk right here, that sparked people's interest, my encouragement, just go on Amazon. There's some really good books on systems thinking. They're not in our profession. That's one of the things that I've experienced in my life. When I meet somebody that is like, wow, they have a lot to offer, and then I interview them, they've crossed domains. So if you're a physical therapist, study osteopathic medicine, study chiropractic. I mean, you don't have to go through the whole process, but study what others study, and you'll see that there's probably more commonality than there are differences. People tend to focus on the differences.
Yeah.
And what's neat is, as much as we're an open system, complex system, we also need to develop a system to deal with the system. Right? Because your first thing that you said to me is, what's the importance of taking a dynamic systems approach to assessment and rehabilitation? And so, well, I started thinking about that. I'm like, well, there's two things to talk about here. There's the fact that we are an open, complex system, and then there's the fact that we need a systems approach to deal with the system. We can't agree that we're an open, complex system and then use reductionistic approaches and think that we can figure it out.
Yeah, it's funny.
That's a technician that's caught in their techniques, as opposed to all the people that I know are listening are clinicians. They have the ability, they're smart enough to think for themselves.
Yeah.
Right.
It's funny because like you are a complex system trying to assess a complex system. So you are the biggest variable in the assessment process is your thought process, Right. You're the biggest confounding variable. And so that's why I think it's so important to have that real, true framework. It's never going to be right, but it doesn't have to be right, because when you're dealing with a complex system, there is no one right answer.
Well, see, that's my dream, is to get people like yourself, and let's just say there's 10 of us, whatever number it is. We all have a framework, but we all communicate because we're working off the framework.
Yeah.
That's one of the reasons why the fourth part of my framework is plan. And then there's a 5-phase plan that I created that looks a lot like the four steps, because it's very universal. It's like, oh, okay, the first is preparation, the next is activation, the next is foundational movement, the next is specificity, and the next is recovery, right? So there's 5 things to it. So I developed that because in pro sports, I saw all these techniques all over the place. And I looked at it as randomness. Unless someone could explain to me the framework and the principles that drove the framework, it's randomness.
Yeah.
That's just my humble opinion. So the idea of making this was one day saying, okay, group, you're all great at what you do, but how do we work together to be greater than ourselves? We have to have some type of system.
Yeah.
We can't just go, okay, the athletic trainer is doing this, the strength guy's doing this, the physical therapist is doing this, because you know what the player gets pissed off at? I don't want any of you, because you're all saying something different from my one question.
Yeah.
And then they end up going, this is what happens all the time in pro sports, they end up hiring their guy.
Yeah.
And rightly so. They want one person because nobody gets along, and it's nobody doing it maliciously. That's the crazy thing. It's the way we were taught. You went to physical therapy, this person went to chiropractic, this person went to strength and conditioning. And everybody gets into their bubble. But with that said, I'm sure there's some questions that we could probably, you and I can banter back and forth with.
Definitely. Yeah, we have a question here from Rick talking about how dynamic systems changes the nervous system when we approach the movement before and after the injury. And so what I'd say, it all comes back, it all depends on the client, obviously, in that respect, but you have to assess the individual's needs. You always have to do a needs analysis, right? And find out what they're missing, where they're not experiencing load. And it's that simple. You can't necessarily say they're going to be expressing this kind of movement discrepancy or that kind of load discrepancy. Is because they're a dynamic system. They will compensate. They will express certain movement strategies that helps them feel safe.
Yeah.
So you just have to allow them to re-experience different strategies based on your framework. Okay. And
that's right. Really well put. And if people are writing notes, this is a humbling way to kind of synthesize what you just said. Write 2 words down: impose and expose. Go do your session, and at the end, reflect the session and ask yourself, how much did I expose, which is what you were saying, versus me impose based on my biases or what I learned in school.
Yeah.
And I did that, and I was like, I'm an imposer. I go to a class, I learn cool techniques, I help open up a hip joint, help a person maybe walk a little bit, but it was all me doing it to them as opposed to them leading the way.
Yeah.
It's a completely different thought process.
Yeah. And I think going back to that as well, I remember looking at some kind of strategy to build better skill sets in an athlete. And they were talking about this idea between practice effects and learning effects. And you can actually look at it from a clinical perspective as well, in that if you're trying to get somebody to move in a certain way, and you're very overbearing in the way you cue them to move, and you're almost straitjacketing the movements into a very rigid way of doing it. You're providing too many rules. You're not giving their system a way to actually learn that. Right. You're not giving them a chance to actually self-organize that information. You're not giving them a chance to actually solve their own movement problems. Right. And so you might get better practice effects where after going through a couple of sets, they look better, but they didn't learn anything. So when they step outside the clinic door into the real world, does it really transfer? Does it transfer from the clinic into the real world? That's what we should be asking ourselves.
Yeah, and I'm not saying sitting here in my high horse saying it's easy. I'll never forget this. I mean, last year I said, how may I help you today? And they go, I don't know, you're the expert. And luckily I was pretty quick on this when I said, actually, I'm not, you are. But then I thought about that afterwards, and it's like, did I lose confidence? But that's the truth, though. Mm. And I'm brutal like that. Like, I don't want to lie to people, I mean, the truth and definition is the nature of reality. And the reality is the person, it's like, I don't want to impose on them. I want to expose why they're here and what's going on, and see if we can't, through our framework and our principles driving it, create a better situation.
I think the issue is that, like, we all want to be fixers, don't we, Lenny? We always want to impose.
Especially men.
We want to say, that was me that did that. Like, I'm the fixer here. Mm-hmm. Instead of actually allowing the client to self-organize and express their own change. Basically, you're just delivering, like, we always say this to people on our courses, is that when you really break it down neurologically, every input that you deliver to the system is just raw sensory information. Yep. When you put pressure through the skin or through a tissue, that's the receptors in your body transduce that pressure into a nerve signal. And that goes back to the spinal cord with lots of other sensory information. So all your nervous system is getting is a package of sensory information. Right. So what makes you think that your unique input was the one that created the change? Now, you can't say that, because it's just raw information until their unique nervous system actually ascribes some kind of meaning to that information.
I like how you put that, raw information. That's good.
And going back to what you said as well, is that it's the subjective portion as well, understanding their unique past experiences, because that's ultimately going to influence how their unique nervous system ascribes meaning to that input. Sometimes I say to people on our courses is, imagine if I'm the best therapist with the best techniques, the best strategies, but you come into my clinic and I remind you of an ex-partner that you really, really hated. Yeah. Do you think that's going to influence how you respond to my techniques? Absolutely it is. Because your system is going to change the way it ascribes meaning to the information now, the way it processes the information, because I've just triggered something. I've triggered a past experience in their nervous system. Yeah. And that's not something that you can obviously clinically change, but it's just something to think about.
Yeah, it would be nice to see if people would like to do this, is to create a course where here's the framework.
Hmm.
We talk about the science that created the framework, and then most of the course is just running people through it, case study by case study by case study, so that you get the practical experience. So you have the knowledge, the skills, but the class becomes the experience. And then over time, you experience that, and then you make judgments on your own. So that's our big goal. It's kind of like when we talk about variability, we did this a while back at the Certified Applied Functional Science program. We said, man, isn't it interesting that we all have different music lists on our phone, or however you carry that list, but there's 7 basic pitches to every form of music. In artwork in your home is different per individual, but there's 3 basic colors. So when we decided to sit down and give practitioners kind of the cheat sheet, that's really what all this is. The framework is a cheat sheet. So it allows me to go into a session. We came up with 10 variables, and we teach that. And now you can take a lunge, for example, which is just a name of a movement behavior, and you can tweak it a million different ways. But with our framework, we could do a class, you and I could put a class together. With our framework, we can see where the efficiencies are. Because what happens with all the variability is sometimes what you get is, like on Instagram, a bunch of crazy stuff. Just variability for variability.
Yeah.
Now, one could argue, hey, that's for my kid, I think it's great. But I'm 53 years old and I can't just do everything. Like, I know where my capacities are, right? I have to still, I'm not afraid to move, but I'm also pretty smart that, well, I haven't done that in 10 years. I might not want to just go for it today.
Exactly. Yeah.
I mean, you got to understand capacities, right?
Absolutely.
Where the person's at.
Yeah, it seems that a lot of people writing in the chat now are really interested in that framework course.
Well, it'd be great.
Yeah, there's something.
I've never done it before where you just, real simple, a couple hours. Here's the framework, here's the science, and you're going to have different way of explaining some of the science as myself. So we go back, banter back and forth, and now we run people through it.
Yep.
Now you group up and you do a subjective intake, then you assess it globally, you assess it locally, and you go in and plan. And then, like I said, I have a template for planning that is overarching. So it integrates all these different techniques that I've seen out there.
And even I think, Lenny, for new grads, like just starting out and even in an outpatient orthopedic setting, let's say, for example, where they're having people come to see them, because you don't really get an awful lot of you don't get a lot of opportunity to develop these frameworks in school, right? And I think that leaves them very stressed when it comes to consultations and assessments in the real world. And so the framework for them, I think, would be crucial,
Right. Well, one of the things that I learned when I was at UCLA, I was taking this class, and this guy was a great biomechanist, and he taught the physical therapists, but he also taught athletic trainers. And but I was in practice at the time, so I was taking night classes, and I asked a question, and I realized right then and there, whoa, the professors are smart. They got a lot of knowledge. They might have a little bit of skill set. You know what they don't have is experience, especially across a broad spectrum.
Yeah.
And you're crossing domains of populations, working with an older person, working with a pro athlete, working with somebody young. And that's why the judgment is going to be different in school. I mean, the professors are not clinicians. It's the same with researchers. And I always say this to practitioners, right? Let's be real. We read research. Let's be honest. We read research. We're not researchers. Dr. Langevin is a researcher. Dr. Robert Schleip is a researcher, right? Yeah, Schleip was a practitioner, and maybe I don't want to speak for him. Maybe he practices still, but mainly he's a researcher now. So what we do is we read research, and we have to try to make practical application of this stuff. Yeah,
absolutely.
I don't know if there's any other burning questions there. But.
No, it looks like just people wanting that framework course. Even Jason Amira, Jason Amira, right? We chatted to him.
Oh yeah,
brilliant. Yeah, we'd love to do some work with him as well, because I think I know that I've been influenced massively by the Gray Institute through my colleague in New York City, and I think that the principles that they use there are fantastic and can be really merged nicely with any kind of approach. So we really have to give credit to them for really influencing the work that we even do at IKN as well. And so it's definitely big credit out to the great institute.
No, great. Somebody asked a question. Andrew asked a question.
Andrew.
There was a question that just came in.
How can we improve upon interprofessional communication, and how can we interact with different professions with this framework? Yeah, that all comes back to education, doesn't it? You just have to get everyone on the same page and everyone respecting this idea that we are complex systems. And so
that's a really hard question, man.
Yes.
You know, Thomas Myers talked about it too, years ago. What did he call it? He had a name for it. Spatial medicine. Spatial medicine, where all the practitioners fall underneath the same umbrella and you create principles, right?
Yeah. Huge.
Because we're all working with people, and we all could pretty much agree that we're trying to help people move, right? Movement's life.
Exactly. Yeah, and that's why we always step back and kind of separate the cognitive experiences of the clients and then the nervous system's experience from a survival, a protective standpoint, because it really helps to kind of merge those two ideas together, where you're not just imposing, but you're respecting the individual's unique experience, but then you're combining that with the needs of the nervous system, which is to exploit the properties of the body to protect your body. Cool, but I think we can wrap it up there. Now, Lenny, do you want to give anyone out there, or the listeners, an idea of where they can find out more about you? Do you have any resources where they can learn more about your work?
I have an Instagram channel. It's soft_tissue_therapy. So soft_tissue_therapy. I just post, little educational tidbits every once in a while. And then through the Gray Institute, we developed a class, the Functional Soft Tissue Transformation. And it comes with a 250-page ebook, which is like a compilation of a lot of the research that I've read that I thought was pertinent to application. So that's important, because I know people have taken the class and they didn't read that. And I'm like, man, there's a lot of information that I was able to extract out and put in a format that's readable and save you a lot of money on books and research papers. And it does go through the local joint excursions. Talks a lot about, principles of sense, motion, integrity. So there's that class that's called FSTT. And if you go to thegrayinstitute.com, they actually have some free education with respect to FSTT. And then there's the Certified Applied Functional Science program that I was a part of that really takes the variables and shows people how to use the variables with foundational movements. And Gary Gray's a huge part of that. So he talks a lot about tweakology, so the ability to tweak the system to create the reaction. And then, of course, they have so many other classes. 3D Maps is a phenomenal class. They have a golf specialization now. They've done a phenomenal job with. And then, of course, the fellowship. But when you go on their site, you can pretty much see all the great information that they have. And I'm indebted to them because, Gary was such a big influence on my thought process early on. But I also appreciate, that we all at the Gray Institute talk about principles that lead us to strategies that ultimately develop techniques. Yeah. And not to get too caught up, as the saying goes, hold your model loosely. Henry Ford said this, all models are wrong, some are better than others. So the point is, as data changes, models have to change. And we're all seeing this with COVID right now. The models constantly change because the data changes. So the thing you hold on to really, really tight are your principles. Hold them really tight because they're not going to change. Just our understanding of them changes. The model, man, and you know what? I'm going to go out on the limb with a strong root system, and I'm going to say that professions are models.
Yeah, absolutely.
Right?
Yeah.
And I see these great physical therapists. I work with some. They're amazing. And what's interesting is, did you learn that at school? And a lot of times the answer is no. They got some foundational information. They learned after they got out of school. They went to your class. They went and saw Gary Gray.
Yeah.
They went to FRC. And when you start to look at, I'm going to ask you, how much of what you're teaching right now did you learn right out of school?
Oh, almost 100% after school.
After school.
After
right?
school, yeah. Nothing,
Right.
well, very little in
And
school.
you didn't come out of school going IKN, I got it.
Yeah, oh geez,
You
absolutely.
developed that because you have this interest in going, you probably questioned a lot of things and you're like, and we all know this, it's not a knock on it, but the academic system is far beyond, or I'm sorry, far behind.
Yeah.
Right? The challenge right now is a sliding filament theory. It's getting blown out of the water.
Yeah.
When is that going to change in the textbook?
Not for
It's
a long
going to
time.
take years. It's going to take years.
Mm-hmm.
Yeah, the sliding filament theory is old now.
Mm-hmm.
And that's where the biomechanics is changing. They're saying Newton would be flipping in his grave right now because they're coming out with, this is interesting. You know how the biomechanics model, first class, second class, third class lever system, got kind of blown up with biotensegrity.
Yeah.
Well, now there's new papers coming out showing the weaknesses of biotensegrity. We're forgetting fluid tensions.
Yeah.
Again, I always come back to studying the cadaver is like studying a telephone pole to find out how a tree works.
Yeah.
It makes no sense. And there's a lot of things that don't make sense. You know what's really funny right now? I hope people don't think I'm too crude with this. I drive around town. There's people in their car isolated by themselves with masks on. Yeah. That's like going to bed by yourself with a condom on. I don't get it. So there's a lot of things. There's a lot of things out there that, it's like we got to rethink. But my point is, it's like it takes time. It really does.
Absolutely, yeah. No, it seems like people are definitely interested in seeing some kind of new framework course distributed out there. So definitely, I think there's definitely a massive need for that. But yeah, but on our end, guys, like I know a couple of people have asked there about how do you integrate the visual and vestibular systems into our assessments. I'm sure that's directed at us at IKN, and yes, that's important. But we need to understand that we don't just go and throw visual drills and vestibular drills at every single person. You need to understand if it's necessary. And so we have different load capacity tests that we use to identify the need to do visual work, the need to do vestibular work. And if you're interested in any of our online courses, we have online courses that give you an insight into all the different pieces of our in-person course. And so you can check those out on our website as well. And we also have our second cohort of our online course starting. It's going out for registration tomorrow, I believe, tomorrow and Friday. It's up for registration for cohort 2. So it's our in-person course in an online version too. And so it'll give you lots of ideas and a framework as to how to assess and facilitate movement rehab with more of a clear focus, I suppose you can say. But thanks so much to everyone for listening in, and I hope you learned an awful lot. I'm sure you can appreciate that when you're looking at things from a dynamic system standpoint, they can seem quite a lot at the beginning, but once you start to get even a little bit of an understanding and start to create your own model, your own framework, it can really reduce an awful lot of stress on you as a clinician or as a therapist or any kind of practitioner. Would you agree, Lenny?
100%. Yeah, you said it so perfect. It's once again the difference between the confidence and what you typically see is cockiness, which is more of a defensive expression in behavior. But the confidence is you have a framework that's solid. And now you can build on it. You take all these different classes, you read different books, and the books aren't confusing because you're strengthening your framework.
Yeah. And that's, I saw a video of someone talking about this the other day, and you mentioned it too, where you shouldn't go to these courses looking for somebody to give you lots of other techniques or completely change your approach, but to add to your framework. Yeah. You should always go to a course and take the information and make it unique to your own approach. And that's what we really try to do at IKN as well. And I know you do it as well. But how can you take these tools, these strategies, and fit them within your unique approach? Because everyone's different. Everyone's going to find comfort with a certain framework and a certain model. But understanding things from a dynamic system standpoint gives you the insight that it doesn't have to be right.
And everybody's intelligent too. Sometimes I go to these classes and the person's up front, being very demeaning. It's like, no, we look at everybody as intelligent. We just have different levels of intelligence, and we're all sharing to try to become better as a whole.
Mm-hmm. Absolutely. Okay, I guess we can wrap it up. Lenny, thanks so much for coming on and sharing your time. I'm sure we'll be seeing more of you with us again soon because
I would love to. That'd be great.
I
I
think
enjoyed myself. Thank you for everybody for listening.
absolutely.
Yeah.
Okay, guys.
All right.
This
See you
is me.
guys. Bye-bye.
Take care, guys. Bye bye.